Welcome, and I will be talking about the divorce, which is psychosocially important, and what kind of psychiatric results can be seen among child. In the title, it says the divorce or some separation or the death of the parent. I will be focusing on them as well. Yasemin prepared the presentation, and I will be presenting it, and we added the literature information, especially the latest studies with the death of a parent or a loss of a parent and the divorce of parent. Are there any psychiatric differences among them, and what are the predictors of the psychiatric problems? And we tried to examine them. When we say single-parent family, when we look at the concepts, family with child or children living with a parent, and death of one of the spouses, prolonged or permanent absence of one of the spouses, or divorce. This is the reason of single-parent family, and most of the researches in this area are related to divorced parents. Every year, over 1 million children and adolescents are involved in a divorce, and parental divorce is a major risk factor for internalizing and externalizing problems in children and adolescents. Parental divorce and psychiatric outcomes. When we look at the studies, cross-sectional and longitudinal studies show that children of divorced parents report more psychological maladjustment than children of married parents. A large body of research has revealed that children of divorced parents exhibit a heightened prevalence of conduct problems and academic problems as well. Findings suggest that divorced parents' communication skills are supportive help, buffer stress and anxiety by changes in cortisol levels. When we look at the 2017 data of Turkish Statistical Institute, the rough divorce rate, when we look at them, in Tekirdağ, divorce rates are higher, and when we look at the other parts of country, we see that the highest divorce rate is in the Aegean region, and in the northern southeastern part of Turkey it is less. And when we look at the yearly information, it is changing, but as the years go by, the increase in the divorce can be observed, along with the death or divorce of the relation between parental divorce or parental death and mental disorders in children and adolescents. This is a retrospective study. This study examined the effects of parental divorce or death on children's mental health, and 4,160 children and adolescents brought to Tekirdağ State Hospital outpatient clinic of child and adolescent psychiatry with the dates, and there is a parental divorce and death, and in 71% of the cases there was a divorce, and in 28% one or both parents lost. When we look at the socio-demographic variables of cases and application time, you can see here there is no significant difference in terms of age and sex. In terms of clinic consultation, the one with the death of a parent within 3 months of time, they come more frequently. And when we look at the results of our study, in terms of the breakdown of the psychiatric diagnosis, there isn't a meaningful statistical result. It's similar in both groups. And the psychiatric diagnosis and their effect on the sociodynamic, the psychiatric diagnosed group is the average age It's meaningful, and it has been found that the children and adolescents in custody given to fathers have a higher psychiatric diagnosis than those given to the mothers. And psychiatric diagnosis of cases in both groups: ADHD, opposing defiant disorder, and conduct disorder. These are externalizing disorders. And afterwards, depression and anxiety disorders. Again, as I stated earlier, psychiatric diagnosis according to socio-demographic and parental variables, the age factor and the custody factor, they play important role. If the custody is with the father, then it increases psychiatric diagnosis. And forensic cases during study dates, 41.6% of the 329 judicial cases brought to the child and adolescent psychiatric clinic were found to have divorce or death stories in their parents, and children and adolescents experiencing parental loss or divorce, according to children and adolescents who didn't have divorce or death stories in their parents, were significantly higher for the forensic case. This ratio is quite meaningful. Reasons why children and adolescents who have lost parents and divorce are forensic cases: 53% understand the legal meaning of the alleged crime. It might be suicide attempt, early marriage, and health care. There were no significant differences in divorce and parental death groups for forensic case rates and causes. As a result, the interesting finding of our study was that the children of divorced families had the same psychiatric diagnosis rate as the children whose one of the parents had passed away. And one of the reasons for this situation, children may not see one of the parents often enough. And in addition, children of divorced parents or children whose one of their parents have died must be monitored psychiatrically as soon as possible. When we look at the studies, along with the parental loss, this is the grief wheel. They can recover or they can continue with the deteriorations. After the parental loss, there is a shock period, and then protest, then weight loss, then disorganization, and confusion, depression, and afterwards start thinking about death, thinking about life, and reorganization and recovery process. In the first 3 months, in the loss of a parent, it can be confused with physiological grief reaction. So we need to be careful about that. When we look at the recent studies, in male twins, a research was conducted. Childhood effects of parent loss, moods, anxiety, and drug addiction. Parental divorce has psychopathology at the adult period, and that of parent, phobias and alcohol, and parental divorce. Different psychiatric results can be frequently seen. And in these findings, early parent divorce has more negative effect. And after the divorce, if the children cannot see that, the relationship between the dad and the children is important. How is the contact? Are there any conflicts? The frequency of seeing the father, the well-being of child, and post-divorce period, and the relationship with the father and contact with the father and supportive relation was evaluated in this study. There are short-run and long-run evaluations. How is the situation in the first 2 years and after 6 years? In the first 2 years after the divorce, the conflicts were more internalizing problems and externalizing problems. The conflict ratio is quite high, and 6 years later, rather than high conflicts, the parental divorce is, or the low contact is more efficient. Even if that relation is a conflicting relation, if they can't see the parent for a long time, it has an important factor psychiatrically. This is another study in the young adults. Parental death during childhood and depression in young adults, a national cohort study. They looked at the types of parental death. Is it a natural death or suicide or homicide or accident? Those who lost their parents when they were younger than 18 years old, they looked at the hospitalization ratio.
The individuals who have lost their parents, in comparison with those who lost their parents with extreme ways, had been found to have less psychiatric diagnostic ratios. Here, the mother and father loss had been looked. It was seen that especially maternal loss had increased psychiatric diagnosis rates, and especially to lose a parent in preschool in comparison with those who lost their parents in school level had increased the depression risk for both inpatients and outpatients. Another symptom which attracted my attention was that especially loss of maternal loss in males caused higher depression risk, 3.23 times more likelihood of having depression in young adolescents in males. In childhood and in adolescence, the parental loss had been looked in the study, and here we see that there is a higher risk of prevalence in psychiatric risks, and maternal divorce causes higher psychiatric disorders. It's very well known, it's already a known information, but in parent divorce, the psychiatric problems have a has an increased likelihood, but in parent loss, all health problems are seen more. But despite those who experienced parental loss, their likelihood of developing a psychiatric problem after adulthood had been found lower, maybe because the sample is low, sample group is low. Thank you very much for your attention.